A variation on osteoarthritis is spondylosis, and really it's somewhere, uh, it's OA of the spine. Age-related changes to the discs, to the joints, to the ligaments of the spine. We've talked about most of it already, but it because it's a common problem, and we'll see a lot of it. It's probably worthwhile to just look at it again in kind of as a separate entity. Um, it's really got to do, so it really means condition of the spine. So it's got to do with osteophytic growth and degenerative change on the facet joints of the or on the vertebral bodies, and it causes pressure on the the spinal cord, which would be a stenosis or nerve roots, and so can cause radiation problems, radiotho- radiculopathies. I'm sorry, I can't. Um, so if it happens at the intervertebral joints, so that's where it does happen, and so the vertebral bodies, the annulus fibrosa, really are kind of like the ligaments and the nucleus pulposa. Um, and it's all about shearing force, etc. When you look at it, like this is a photograph of obviously somebody that has passed away, but you can see the osteophytic growth at the vertebral body, and you can see um, that they're growing in all directions, but some of them are extending back into the vertebral foramen where the spinal cord is, and so the neurocentral ones are essentially pushing on the spinal cord, and it's also making the intervertebral foramen, which is this area right here, um, a little bit narrow and can affect nerves there. Now you also see that the facet joints, the posterior joints, uh, are getting an osteophytic growth. The one on the right hand side of the picture is way worse than the one on the left hand side of the picture. When you see them on X-rays, you see it looking like this, and I've seen hundreds of X-rays that look very much like this. You can see that osteophytic growth where the line is pointing uh, between the two vertebrae. Now that to me looks like it's between 6 and 7, uh, which is a very common place post whiplash. Kind of 15 years after an untreated whiplash, that's what it ends up looking like. So this is part of that degenerative disc disease that we talked about before. Um, Now, the interesting thing about it is that people see an x ray that looks like that and they think, oh my God, that looks horrible, it must cause pain. Not necessarily. It only causes pain if it's pushing on something. Uh, so it causes this loss of range of motion. Now, uh, there is a variation on this that happens at multiple levels at the same time, and it's called DISH, diffuse idiopathic skeletal hyperostosis. Um, uh, Interestingly enough, I had a patient, and I diagnosed with DISH when I was doing my internship, and it was a very rare thing, and I had to do a presentation and clinical rounds about it, and I had, it seemed that uh, I had the luck or the misfortune, however you look at it, of having this really kind of rare, interesting case that I had to make multiple presentations on. And um, when I first moved to Barrie was a fairly small town. I started practicing here in '86, and almost one of my very first patients reminded me of this guy that I had, and I sent him to the hospital to get x-rays, and sure enough, he ended up having DISH as well. And I ended up kind of talking to some radiologists and some of the doctors at the hospital about it, that I had seen this before, because These guys hadn't actually. So it's a fair dish is a fairly rare thing. It's idiopathic, and it's kind of like a spondylosis gone nuts at multiple levels. Um, Typically it's arthritis at the facet joints. It can be at the SI joints or the where the ribs meet, but it's primarily facet joints is the typical thing. It doesn't necessarily cause signs and symptoms and just loss of range of motion. It causes pain if you're compressing on the nerve roots or the spinal cord, if there's a spinal stenosis. It can actually cause enough spinal cord compression that there's a loss of bowel and bladder control. The sphincters stop working. The um, the voluntary sphincters. Um, it can also uh, cause pressure on blood vessels. This is especially difficult in the cervical because you can see if we were to go back um, to this shot here, this point right here is where the vertebral artery goes and feeds the occipital region of the brain. And you can see that if the osteophytes start pushing on that, it may actually impede circulation to the brain and give um, transient ischemic attacks in the brain, little kind of mini stroke sort of things. It so that can be a major complication of it. Um, yeah, and kind of quite scary for practitioners, really. Um, so you see it on X-ray or MRI if you're lucky enough to be able to get an MRI. Um, you got to be very careful when you're working around it. There's these people take anti-inflammatories because it's just like OA, except it's in the facet joints of the spine, and it carries these different complications. Basically, the neurological and the vascular complications.